Gynecologists usually perform gynecological surgeries. The surgeries include procedures for benign conditions, infertility, and incontinence. Joining me is Dr. Cooper. He is a gynecologist here at Women's Care. So, Dr. Cooper, what are some of the most common procedures you perform?
Well, just problems for women when they have issues in the pelvis. So the female organs, the uterus, the cervix, tubes, ovaries, problems like that. Some of those issues can be painful, problems with menstruation, heavy periods, endometriosis, those kinds of things.
So, how do you determine if a woman is a candidate for surgery?
That's a great question. We start with the problem and frame the problem, try and really understand the problem. And once we understand the problem, move into trying to understand what non-surgical options we have available. Sometimes they're as simple as taking ibuprofen, sometimes different medications will be helpful, and sometimes other devices will be helpful short of surgery. So if we can go down that avenue first, we always like to try that. It's almost always less risky, less costly, faster return to work, and a lot easier on patients.
So, after having a conversation with your patient, how do you actually come up with a plan?
Well, it's really individualistic. It depends on the particular patient. We can have conversations where someone says, I just want it all out now, and someone else would say, anything but surgery, and sort of laying out those options. It's my job to take as many of the options that are out there and put them on the table and explain the pros and the cons and the risks, and then see how that fits in with that individual patient. And so one person might come in with one frame of thought and might leave with a different idea, or might go out thinking she's getting exactly what she needed. But it really is an individual process.
If a woman needs a hysterectomy, what does that look like and what is the recovery time?
Well, that's changed over time. Back in the day, it used to be that women would typically be off work for 6 weeks and have a rather large incision. And we're fortunate to have other options these days. So with less invasive surgery, women are often back to work much sooner than that. And in general, especially if using a laparoscopic approach, a lot of women are back to work within a couple of weeks or even less at times.
If you have a hysterectomy, does that mean you have to take hormones the rest of your life?
That's a great question. It's a totally separate question because you can have a hysterectomy and retain your ovaries, and that doesn't affect your hormones at all. And there are other conditions where the ovaries might need to be removed, and in those cases, one can take replacement hormones, but most often, most women would retain their ovaries and they don't need to worry about hormones in the future.
I assume women are concerned about their chances of getting pregnant after surgery. What do you tell them?
Well, often they are. Not always, but often they are. And if that is part of the conversation, then we go through the purpose for the surgery, and often surgery can even enhance women's ability to become pregnant. For instance, a myomectomy, where a benign growth is removed from the uterus. Other surgery would not involve fertility at all, so it's definitely a conversation that we have. We need to know what future childbearing plans are and plan accordingly.
In this day and age, do you find it that people are concerned that the Da Vinci system or the robot is going to do that actual surgery procedure for them?
There are some who have that concern, and it's a great tool, it really is, and it has really advanced minimally invasive surgery and really made it possible for us to do things that we haven't been able to do before. But I do hear from some patients that they're concerned that the robot might go rogue, and try and explain that it's not really a robot. It has arms like a robot might have, and it has articulated parts, but it's a one-to-one movement. So it's really better to think about the Da Vinci system like a drafter would have a table. So every movement that a drafter might make on the other table, it's reproducing the same movements. And so we're still operating, it's still our hands in the console, and it's just doing what we're doing in a different place. So in that sense, it's reassuring to know that it cannot move by itself.
Thank you for joining us. For more information, you can go to womenscare.com and subscribe to our YouTube channel.
Thanks for joining us. We love to help at Women's Care and are really dedicated to women's health. We look forward to helping you in any way that we can.